Hospital-acquired pneumonia, or HAP, is a lung infection that some people get while in the hospital. It is a serious condition that can complicate a patient's recovery and extend their hospital stay. It's different from pneumonia you might get outside the hospital. CHAP is often caused by bacteria that are more resistant to antibiotics, making it harder to treat. HAP usually starts at least 48 hours after a person has been admitted. This delay is crucial for distinguishing it from other types of pneumonia. This type of pneumonia can be very serious. It can lead to complications such as respiratory failure, sepsis, and even death if not treated promptly and effectively. People already in the hospital may be weaker or have other health problems. These underlying conditions can make them more susceptible to infections like HAP. This can make it harder for their bodies to fight off the infection. The use of medical devices like ventilators can also increase the risk of developing HAP. CHAP is a significant concern for patients and their families. The emotional and physical toll can be overwhelming, adding stress to an already difficult situation. Understanding what causes it, how to recognize it, and how to prevent it is crucial for anyone in or visiting a hospital. Proper hygiene, timely medical intervention, and awareness can make a significant difference in preventing HAP. Most of the time, HAP is caused by bacteria. These tiny organisms can get into the lungs and cause an infection. Some bacteria are already present in hospitals. One way these bacteria can infect people is through breathing tubes, like ventilators. If these tubes aren't kept clean, bacteria can travel down them into the lungs. Another way people can get HAP is if they have trouble swallowing. This can happen after a stroke or surgery. If food or liquid goes down the wrong way, it can carry bacteria into the lungs. It's important to know the signs of HAP so you can tell a doctor or nurse right away. Some common symptoms include a new or worsening cough, fever and chills, feeling short of breath, chest pain, especially when breathing deeply, and feeling very tired. Sometimes the signs of HAP are not as obvious, especially in older adults. Confusion or a change in mental state can also be a sign. It is essential to report any unusual symptoms to a healthcare professional promptly. Section 4. Diagnosis and treatment of HAP. Doctors use different methods to diagnose HAP. This often starts with a thorough review of your medical history and a physical examination. They will ask about your symptoms, such as cough, fever, and difficulty breathing, and how long you have been experiencing them. They will listen to your lungs with a stethoscope. This helps them detect any abnormal sounds that might indicate an infection or fluid in the lungs. They will also likely order a chest X-ray to look for signs of infection in your lungs. The X-ray can show areas of your lungs that are affected by pneumonia, helping to confirm the diagnosis. Another way to confirm HAP is by testing a sample of your mucus. This sample is usually collected by having you cough deeply to bring up mucus from your lungs. This helps identify the specific bacteria causing the infection. Knowing the exact type of bacteria allows doctors to choose the most effective antibiotic treatment. Once diagnosed, treatment for HAP usually involves antibiotics. These medications are designed to kill the bacteria causing the infection and help you recover more quickly. These are medications that kill bacteria. Depending on the severity of your infection, you might be given antibiotics in pill form or through an IV. You will likely receive them through an IV, especially if you are very ill. This method ensures that the medication gets into your bloodstream quickly and starts working right away. In some cases, you may need help breathing. This can happen if the infection has caused significant inflammation and fluid buildup in your lungs. This might involve getting oxygen through a mask or nose tube. Supplemental oxygen helps ensure that your body gets the oxygen it needs to function properly. If breathing is very difficult, a machine called a ventilator can help. The ventilator takes over the work of breathing, allowing your lungs to rest and heal while ensuring that your body gets enough oxygen. Section 5. Preventing hospital-acquired pneumonia. There are several measures hospitals implement to prevent hospital-acquired pneumonia, commonly known as HAP. However, patients and visitors also play a crucial role in minimizing the risk. Hand hygiene is paramount. Washing your hands often and thoroughly with soap and water is one of the best ways to prevent the spread of germs. Use hand sanitizers when soap and water aren't available. Oral care is another critical aspect. Keeping your mouth clean by brushing your teeth and using mouthwash can significantly reduce the number of bacteria in your mouth which can help prevent infections. Respiratory hygiene is essential. Always cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Dispose of tissues immediately and wash your hands to prevent the spread of germs. It's also important to talk to your doctor about getting vaccinated against pneumonia. Vaccinations can provide a layer of protection against the bacteria that cause pneumonia. Some vaccines, such as the pneumococcal vaccine, can help protect you from the bacteria that cause pneumonia. Make sure to stay up to date with your vaccinations. If you have any concerns or questions about hospital-acquired pneumonia, don't hesitate to ask your doctor or nurse. They are there to help you and provide the necessary information to keep you safe.